It's difficult for me, frustrating for you trying to help people, and then also it's frustrating for you as a patient, right?
Yeah, it's funny, nurses always put patients first. It's just part of what we do as people. And so more so than even being worried about our own safety, we're truly worried about our patient's safety. And if we don't know if we're infected and we're told to go to work and take care of patients, let's remember most patients in our hospital system don't have COVID right now. They have heart attacks, stroke, diabetes, hypertension, the things that we worry about for people that get COVID. And how can we protect them if we're not protected ourselves? And that's the moral dilemma that every provider is feeling right now. And it
Right.
goes against every ethical code that we've ever had in practice.
So if you spend 9 days not knowing if you have it, and days before that, before you were even tested, you could have unknowingly been interacting with cardiopulmonary patients and infecting them, not knowing you're carrying the virus.
Absolutely. And that was my concern when I called on Monday of last week. And I said, I'm worried about patients. I'm going to see a lot of patients, a lot of healthcare providers through the week. And in the back of my mind, I thought about the week prior when I had that chest tightness and thinking to myself, my gosh, I was in touch with patients all week long. Did I harm anyone? Was I infected? Am I infected? And I've talked to other providers that are positive and they feel the same amount of shame. And it's really hard because it's something that's so out of our control right now. But it's really, really difficult to kind of grasp.
Well, I heard the story of a nurse in Italy that tested positive and actually committed suicide, reportedly from the guilt she felt for having possibly infecting a whole lot of others.
Yeah, it's real. I mean, I can tell you last week when I got sick and when the country started shutting down and dealing with the unknown of what I have going on, dealing with the kind of anticipatory grief that healthcare providers are feeling of this cloud coming over them. um, the mental health struggles become real. And I reached out to a lot of my colleagues, and we don't like to talk about it. We don't like to say that we're not well or that we're scared, and we are. We really are.
And you're in isolation now?
So I am home in self quarantine. I was told last Monday to go home and self isolate away from my husband, away from my animal, and I did that. I said yes, that's what I'm going to do. Um, and I didn't last very long. I mean, the mental health struggles that come from self isolation alone, on top of being sick, on top of a pandemic, are real. And I'm not saying that other people shouldn't do that, but it was a discussion between me and my husband that what was best for us and for my health was to be together. And so that's what we decided to do. So the two of us are self quarantine in the house right now.
Okay. And do you feel like you're on the mend at this point?
Um, yeah, I was talking to a friend who's also similar symptoms to me, denied testing, and he said every day has been a little bit better for him. I feel like I've had some good days and some bad days. Today I feel a lot better. I just feel wiped out. I feel like, I run through the differentials in my mind. I'm like, all right, is this mono? Do I have gastroenteritis? Like, what are my other options if this comes back negative? So, I still have some low grade fevers. I have a lot of malaise and some nausea, but I feel I'm getting better.
Are you concerned that you may infect your husband?
Of course I am. That's why I wanted so badly to self isolate to protect him. And it's funny because he was like, Megan, if you have it, I have it too, probably.